What actually is a bariatric surgery?
Yeah, of course, I understand that surgery sounds a little scary, but surgical intervention, which is known as bariatric surgery, is the proven, safe, and scientific method for a sustainable weight loss. So, we are not only talking about people losing their body weights, but losing it to an extent where it actually brings about positive changes in their health and also maintaining that weight loss.
Hello, everybody. Today we are going to talk about health and what is smart living. And we have with us Dr. Atul Sardana, who is a bariatric surgeon, and he's done a lot of transformations. So we are here to learn about all the transformations of life. So let's go ahead. Hello, Dr. Sardana.
Hi, Payal. Thank you. Thanks for the introduction.
Okay. And let's start off with the first question. What actually is a bariatric surgery?
So, bariatric surgery primarily is a surgical procedure that is aimed to reduce the weight of an individual
Okay.
for a patient, and these are recommended in certain settings.
Okay. And, nowadays we've heard about all of these injectables, the trending injectables. Why would one person opt for a surgery instead of the injectables?
Yeah, of course, I understand that surgery sounds a little scary, but surgical intervention, which is known as bariatric surgery, is the proven, safe, and scientific method for a sustainable weight loss. So, we are not only talking about people losing their body weights, but losing it to an extent where it actually brings about positive changes in their health and also maintaining that weight loss. So when we talk about drugs or when we talk about other things now, there are a lot of drugs which have come in injectables.
Absolutely.
So they are basically in two categories. One category is injectables which are primarily prescribed for diabetes, and they are not being prescribed for obesity, but they are being misused for obesity.
Absolutely. Everybody is just going for it.
Yeah. And now there are new drugs which have come in, which is prescribed for obesity management.
Okay.
But with these new drugs which have come for obesity management, you will end up losing about 15 to 20 kgs of weight
Okay.
over a period of time. And that weight loss maintenance is not there after you give up the drug. So you will have to continuously keep taking that medicine to be able to sustain that weight loss. And here we are talking about morbid obese people. We are talking about people who are 60 kgs overweight, 80 kgs overweight.
Okay.
So changing 15 kgs will not make a major difference to them in terms of resolving their problems which are associated with obesity, such as diabetes, hypertension, sleep apnea, varicose veins, PCOD. So there are multiple problems associated with obesity.
Okay. And you also just mentioned that with the surgery, you are able to maintain the weight loss.
Yes.
How does one do that?
So, surgical intervention primarily is aimed at two things. The first is reducing your intake, that is known as a restrictive effect.
Okay.
And the second is known as a malabsorptive component, in which not only will you eat less, but you will absorb that less also.
Okay.
And these changes are permanent until unless reversed surgically.
Okay.
And this surgery itself raises the level of GLP-1, GIP, works on glucagon receptors, but also has other effects such as reducing ghrelin, reducing your hunger, working on polypeptide Y, and reducing overall inflammation.
Sounds amazing.
Yeah.
So there's no overeating after the surgery. One cannot think that surgery karali and now I can overeat.
So surgery is primarily intended for people who have taken a call that they want to transform their lives.
Okay.
So for whatever period of their life they've been obese,
Okay.
they've been subject to ridicule, they've been subject to being outcasted in their society, or not being accepted that well.
Okay.
People who are suffering from diseases such as diabetes, hypertension, which will eventually cause other complications also.
Okay.
And for that matter, obesity is also related to 13 different cancers. So
True
people
that.
who take that call that we
Okay.
want to now change our lives are convinced enough that they are not going to overeat.
Okay.
And once this procedure is done, your quantity is fixed. You will not overeat. You don't feel like overeating.
Okay. And also, of course, when you see yourself so healthy, you
Yes.
feel that confidence.
Yes.
You feel
Yes.
so good about yourself. Why would you go the other way?
Exactly. So it's a positive change, And
Okay.
that positive change is there to stay. It's not going to go away tomorrow.
Awesome. So this is something permanent.
It's a permanent thing, yes.
So we can conclude to this that if you end up taking the injectables, and the moment you stop those injectables, it's a possibility that all that fat might come back.
Yes, that's
And
true.
with the surgery, definitely there is less possibility that the fat will come back. Is that so?
So with the medicines, you are injecting those endocrine or neurocrine hormones,
Yeah.
such as GLP-1,
Yeah.
GIP, and as long as their levels are maintained in the bloodstream, you have less amount of hunger, you eat less, and your metabolism changes.
Yeah.
The moment you give up those injectables, you will fall back to where you were. With
Okay.
surgery, all these
Are taken.
neuroendocrine these will rise.
Okay.
The hormones will rise,
Okay.
and they will stay there. So you don't need to keep taking
Sounds
them.
awesome.
And
Then
they're
why
going
go
to
for
be
these
there
things?
for permanent.
Awesome. And so when one gets the surgery done, what is the time period that one needs to be lying down on
So-
bed, or what is the recovery period?
So all of the bariatric surgeries, the various types that we do, are done laparoscopically.
Okay.
The patient is encouraged to get up, walk the same evening.
Oh
The
wow,
patients are discharged home in 2 days.
that's amazing.
And most of them return to their work in, say, about 4 to 5 days.
Awesome. I think that's amazing.
Yeah.
And what about how easy it is on pockets? Like, how much do we need to spend on a particular surgery?
So,
Or is it like the same surgery that everybody goes for?
No, not essentially. So, surgery, there's no one surgery which fits everybody. There are a
It's-
couple of procedures
you
that
customize
we do.
it.
So, we customize it according to the patient's weight,
Okay.
his age,
Okay.
the kind of comorbidities that he has.
Okay.
And these end up being as expensive as 4 to 5 months of treatment cost with the injectables.
Oh wow.
So, you're getting a permanent solution at the cost of 4 months.
Awesome.
Yeah.
And I believe these injectables are quite expensive, and you just
They're
have to
very
carry them on.
They're very
And you
expensive.
normally don't even have the energy to do anything.
Yeah. So with these injectables, I recently went through the trial reports that are published,
Mm-hmm.
because these injectables have been there in the US for the past 2 years or more than 2 years.
But they're trending now in India.
They are being launched in India now,
Mm-hmm.
but they have gone off trend in the US.
Okay.
Nobody now prefers using them because one, they're expensive. Two, it's a permanent reliance on the injection. The day you stop, you'll
Stop.
start getting back.
Absolutely.
And three, there are a lot of problems aesthetically as well as clinically that these injections are posing. So you tend to be tired, you tend to be fatigued, you tend to eat less, you tend to vomit, you have diarrhea. More than that, the kind of weight loss that happens is not only fat, you also have muscle loss.
Okay.
And when you have muscle loss, then you have this typical Ozempic face, as we call,
Yeah.
as we see nowadays.
Yeah, more like a haggard
More like a haggard or,
all
or a
over the
saggy
body
face.
and the face.
Yes.
Yes.
Yes. And then there are other side effects which are very serious, which are not being spoken about, such as pancreatitis,
Okay.
such as liver failures, and blindness. So these have been reported now.
Okay. That's actually awful. And I think surgery is the way then.
Yeah.
So, is there a age factor to the surgery? Like, can a teenager go for a surgery, or can a senior citizen go for a surgery? Or
Right.
is there a weight factor? What is it that you look for, or who can opt for the surgery?
So to be a candidate for bariatric surgery, weight is an important factor.
Of course.
You need to have a certain BMI before we say you are a potential candidate for a bariatric surgery.
Okay.
So we qualify BMI as your weight
Okay.
divided by your height in square, that is taken in centimeters.
Okay.
And if you have a BMI of more than 37.5,
Okay.
or if you have a BMI of more than 32.5 with these comorbidities that I was talking about,
Okay.
such as hypertension, diabetes, sleep apnea, PCOD, varicose veins,
Okay.
then you are definitely a candidate for bariatric surgery.
Okay.
Age is not important for us to decide on doing bariatric surgery, but yes, fitness is. So in case you're medically unfit for anesthesia, we might refrain from doing that,
Okay.
but that means to say that you are too late to even choose this option. In terms of teenagers, as you said, now we see a lot of obesity happening in teenagers.
Yeah, with all the junk food
Yeah,
and
with
all of that.
Easy availability to junk food, food being available 24/7
Yeah.
at the
Yeah, I
press
know
of a
that's,
button.
yeah.
Lack of exercise, always into gadgets. So we are facing childhood obesity as an epidemic now in India.
True that.
And obviously, the first choice is to correct the lifestyle,
Okay.
to encourage children to eat healthy, to encourage children to do exercise. But then diet and exercise not is usually not the solution for morbid
Yeah,
obese.
sometimes, they just like cross that line and they are just overweight.
Yes. So it is basically a defect of metabolism. Not everybody who's overweight has a defect of metabolism.
Okay.
But then if you have this defect of metabolism, even though you will lose weight with diet and exercise, well, it's going to bounce back.
Okay.
And there we realize that their bariatric surgery has a definitive role to help these people.
Okay. How old has your youngest patient been?
So the youngest I've done is 16 years.
16.
16.
That's amazing. And what was her or his weight?
So he was 129 kgs.
Okay.
And we operated upon him. He is now in his 80 kgs range, 80,
Oh,
82.
he must be blessing you.
Totally. The life is totally changed.
Yeah. It sounds
Totally
amazing
changed,
from 120 to 80. And how long did he take to lose that kind of weight after the surgery?
So usually this weight loss occurs over a period of 18 months, 1.5 years.
Okay.
Initially it is a little rapid, but then gradually it would taper down.
But I think that makes a lot of sense because at least the energy levels are,
Yes.
there.
Yes.
So that's
we
most
very
important.
rarely find patients complaining of lack of energy.
Okay.
That's never there.
Okay.
That's never there. In fact, when you start losing weight, you become more energetic.
Absolutely. And you're
become-
eating less, but you're eating healthy.
Yes.
Yeah,
correct.
and that should be the lifestyle any
That
which
should be the
ways.
lifestyle, exactly.
That's amazing. And what about what has been the age of your oldest patient?
So the eldest patient we've done is 76 years old.
Oh,
Yeah.
amazing.
And this gentleman was 161 kgs.
Okay.
He's now at 83 kgs.
Awesome.
Yeah.
So you keep getting a lot of blessings your way. That's
Of course,
amazing.
yes,
Good.
Yes,
Good
it's a
work.
transformation, and we are very glad that we can be part of our patients' journey.
No,
to
I think
changing their
that's
lives.
what else can you give to your
Yes.
community than giving them healthy lifestyle.
Yeah.
I mean, that's kudos to you. Dr. Atul, is there any journey of a patient that you remember that you would like to share with your viewers?
So every journey is unique, and every
Okay.
journey is beautiful. When you see your patients turning up after 6 months, turning up after a year and a half, and they change individuals, their entire perspective towards life is changed. So I would not specifically want to mention any names or any one individual. But yes, so what we see is we see young girls coming in who are obese,
Okay.
who are nearing marriageable age, and because of their obesity, their choices of finding partners is very limited. Sometimes they are in a position where they have to compromise on the kind of partner that they want.
Oh, that's sad.
And these girls, when they opt in for bariatric surgery, in 1.5 year, they're absolutely changed individuals from people who go to, who are afraid to go to malls, who are afraid to go shopping, are now keen going on malls because every size fits them.
Wow.
Clothes are available for them.
Oh, wow.
So that's so exciting.
Yeah,
they can go
true.
and they can enjoy life, with their friends. They
True.
can go on treks, they can go to mountains, and suddenly, things change for them. So this is one case scenario. Then we face middle-aged women who've gained a lot of weight, especially after their pregnancies and deliveries.
True that.
And that's somehow not going.
Okay.
And so we had one very unique female who had gained weight after her deliveries. And,
Okay.
and so as doctors, we always focus on, so you have hypertension and you have diabetes. But her real problem was that she says, because I've gained weight, I feel shy in going out with my husband anywhere.
Oh.
I'm at home.
Okay.
And after this surgery, she said, my biggest achievement is the fact that I go out everywhere with him.
Oh, wow.
Now these are real achievements for patients in their
Absolutely. Yeah,
transformation.
you're doing the mommy makeover. You're,
Yeah.
giving confidence
Yeah.
to people.
Yeah.
And you're
And-
saving marriages, you're getting people married. I mean, it's just amazing.
It's not like that, but yes, these
No, but it
transformations,
is a fact.
transformation help people being more acceptable, accepting society and society accepting them.
No, it's very important. Otherwise, people can just go in their own shell and things like depression
Yes.
and many more things
Yes.
can happen.
Depression is very common with obesity.
Yeah, absolutely. Yes. It's the race any
Yes,
which
and
ways.
transformation is a journey.
Absolutely.
And I always tell my patients to enjoy that journey rather
Absolutely, yeah.
just
So
going
with
through
us also, we always take before and after pictures.
than yes.
So if somebody's been with us for a year, we do show them their skin,
Yeah.
and then they themselves, they're very shocked. Oh, I used to look like that and I love myself now.
Yes.
But it's happened over a period of a year.
Yes. And I think falling in love is the biggest transformation which happens. Falling
With
in love
yourself, yeah.
Falling
I
in love
think
with
that's the
yourself,
most
yes.
amazing thing you can
Yes.
do.
Yes.
Fall in love with yourself, treat yourself, and life is all yours.
So that's what I believe. The moment you fall in love with yourself, then is the time that you really want to undergo this transformation.
True that.
Yeah. Yeah.
So kudos to surgery and the non-surgical
And of course,
department.
of
All
course.
is great.
So the entire process goes hand in hand. So the nutritionist is there, and we are there as bariatric surgeons. We also have, it's a team effort.
Absolutely.
So we have endocrinologists, we have
Absolutely. And I
nutrition.
really believe educating a patient is very important. They all should know what they are going in for and the expectations, it's not that, you go under the knife and voila, in one day,
Yeah.
you're going to lose all your weight. And same goes for aesthetics as well.
Yes.
Just one more question, Dr. Atul. Is bariatric surgery a quick fix?
Honestly, not. It's a journey in itself,
Okay.
and it's for the people who have now decided to transform themselves. So it's not a quick fix. It's not a cheat.
Okay.
It's a strong-willed person's decision to be able to change themselves.
Okay.
So no way that you can call it quick fix.
And any which ways, I think the surgery word sounds a little scary, but you've anyways said it's not a surgery.
So it's done laparoscopically. You
Yeah.
have very small incisions. We hardly ever end up putting stitches or dressings.
which is amazing.
Yeah. So the patient, is up and about in the evening.
Okay.
So and it's a planned surgery.
Huh.
Everything is planned in advance.
Okay.
Nowadays, the risk of having a bariatric surgery is equivalent to having a gallbladder surgery or an appendix surgery.
Yeah,
which are
but I
commonly
think
done.
but people just think hear the name surgery and they normally get scared that they're going to go in a OT under the knife and all of that. But which you have clearly mentioned. I
Yeah.
mean, it's nothing like that.
Yeah. And surgery is one part of the entire journey. Diet, post-operative follow-ups, trying to be healthy, trying to live healthy, trying to eat healthy is what we actually train our patients. Surgery helps them in maintaining their resolution as to eating healthy and eating a certain amount. So the change actually happens with the patient himself. It's not the surgery doing the change.
Yeah.
It's the patient transforming themselves, and surgery is just an assistive part to it.
That's amazing. And anything that you would like to tell our viewers, would you like to conclude with something?
So, what I want to convey to your viewers is the fact that obesity is a disease. So do not take it as a personal problem. Consider it as a disease. Go consult a doctor. Try and understand your options. Obviously, the first line of treatment stays as diet and exercise. But in case you're not able to lose weight or your weight is significantly high, as I said, in terms of BMI, and the weight loss that you get with diet and exercise does not stick with you, do not accept this. Do not accept this disease as this is how I am. There are multiple options available. Be proactive. Opt in for surgery in case you're a surgical candidate and get yourself transformed into a healthy individual. Thank you.
Amazing. I think consultation would be the first step. Acceptance would be the first step.
Acceptance.
Then
exactly.
consultation, and one can always sleep over it
Yeah.
and go through the whole transformation.
Right.
Amazing.
Right.
Thank you so much, Dr.
Thank you.
Atul. It was
Bye.
amazing talking to you.
Pleasure.
And health and happiness to everyone.